Now comes, I'm not going to say now comes the good part, but I mean, it's good speeches and great dialogues, right? Let's see. Okay, hit us.
Yeah, absolutely. I love these talks. I also love that someone else was talking about diabetes. I think, as a researcher who works within wearable technologies, the whole idea of health tracking seems like a new idea, and we forget that diabetics are the original health trackers, and we can learn so much from them. And I actually have one of my new panel members, Hendrik, who works within Brighter, and he has some questions about that.
Well, I think it's very interesting to listen to both of you, your companies, even though the neuronation is not in specifically diabetes, but I think the motivational aspect is key here. One of the questions that we've struggled with at Brighter is how do we actually get the users to stick and to stay with the app and to actually engage? And you were close to it, but I didn't really feel convinced as to how do you get it done? Because, I mean, we know that halftime on a wearable is 2 months. We know that halftime on an app is even shorter. And out of the 400,000 downloads, which by numbers is a great number, we know that there are millions more that could be potential clients. And out of those 400,000, how many are actually using it? And how many are paying the €4 a month for the premium services? I'm not asking you to share confidential information, but it's really a functioning, how do you get the stickiness to stick?
Yeah, very good question. So how do we maximize retention and how do we minimize churn, right? Mm-hmm. So
it's built on a few different things. First of all, you have to work on the feedback loops so that you feel progress in using the system, and that you see progress in how you are doing yourself. So how we create a feedback loop is through feedback on every activity. If you enter pizza, have a high blood glucose, a monster comes up and tells you about what's going on, yeah? Just pulls a joke or whatever, yeah? It gives you a feedback loop which is not entirely connected to diabetes, but expresses, what's going on, like an emotion. That's what it expresses. We also use gaming elements, such as points for every activity you take, which is connected to taming the monster. So we use a lot of gaming there. When it comes to your setting goals for yourself, something which is often lacking in diabetes therapy, we have set up challenges in cooperations with different companies as well as nonprofits, where one of my favorites is with one of the biggest diabetes nonprofits. If you take one blood glucose test a day for a week, pretty simple, but in that case, you support through us the JDRF, which is working on finding a cure. So we connect your taking care of yourself, doing good, well, actually doing well, we connect it to doing good. And that brings yields a very strong connection with taking action and with sticking with it.
Jacob, any? Any minute now?
No?
Yes?
Oh,
yes.
Awesome, great. It's incredibly important to make sure that you track every single second, especially the first minute of the product usage. This is where the biggest amount of churn actually happens. So what we do is we optimize. We have like around about 3 to 4 test experiments running every single minute. Actually, since when we are talking right now, we have like 4 experiments running in the app. So you need to make sure that the people engage first, that they have like an instant feedback and instant like kind of awards achievements, instant endorphin loops in the product. In the first minute, it's just incredibly important. And then you end up somehow with educational basis. We call it like small brain snacks. So make sure that you give them an understanding what it is, have the first actually achievements, engagement tasks happened in the first minute, and ended up with some brain snacks, some education. So we're talking about this engagement loop. I mean, you can skip the community thing in the first part. But when you optimize on that every single second, then you will probably reduce churn by 80% and more. This is what we did like in the last 3 months, and it happened it's worked out incredibly good. So that's the first thing. The second thing is also try to build up assets. So people are investing the time on it. What do they get back out of it? So it has to be something visible in the product. What I like, actually, you can put it in stuff, into my sugar, so you build up assets. You create a lock-in effect. It's the same you can do with almost every product. So with Neuronation, you also build up your activity, you achieve new levels, which are opening up new stuff for it. For example, new games, new courses, which will help you to increase your skills in, for example, focusing, not only in memory. So this is how you create like engagement and retention as a product.
So metrics to start.
Always.
And do you sorry for interrupting, but and you also, this is something that you've sort of iterated incrementally all the way through as well?
Yes.
I heard a really interesting talk on what actually makes successful startups, and one thing was measure everything you can, because it's about insights, not instincts. Even though you think something might be working, you don't know it until you actually see it. So excellent. Anything else over here?
Yeah, Carolina Antonov from the Research-Based Pharmaceutical Association, and of course I see parallels here, what you are doing and what our members are doing with their pharma products. And to be a bit offensive, I would say maybe your ambition now is more of a nice to have, and you can have revenues for private persons paying this, but to go for a real revenue, everybody knows that society pays for pharmaceuticals, and to go for that, then you have to put in much more ambition here, I think, to show the effect scientifically and show the value in health economic assessment, because then you could really reach revenue. And of course, then you have to decide, is it your digital product with a pharmaceutical product? Is it on its own? Or is it to suit all pharmaceutical products? So I think I see sort of a ambition crossroad here. And I also miss out that you haven't talked about revenue from data. I have members who are very interested on data, on how their pharmaceuticals are actually working in real life.
Shall I start? Revenue on data. The data we manage is medical data. It is not something which is sold to other people. It's not something we intend to make revenue on. This is medical data belonging to the patient. We have the honor of hosting it for a while, and that's that. So we don't make money on that. When it comes to clinical trials and showing the effect in a clinical setting, imagine this. A medical device which changes every 2 weeks. Let's run a trial. To have success in the B2C market, what do you need to do? Well, keep working. Add new functionalities, optimize, make it more of a pleasure to use. If we apply this as in a randomized clinical trial, well, we will have a totally different product in 2 years when the trial ends. So we have opted not to go that route yet. And considering the fact that in 3 years on the market, we've had 3 major revisions to the product. And we're adding bolus calculation, we're adding new features by the month. The product changes so tremendously that it's hard to actually put the money and effort in for 2 years to then have something totally different on the market, because the market has moved on. So I believe we need to come up with a different concept when it comes to validating mobile health applications focused on B2C and chronic disease and behavior. I think that we need to come up with a model which allows for change and for simple things to be tested live. That's what I believe. Otherwise, it's a lot of money being drained, simply.
Can we talk about medical data, actually? Because no, I had a great interview with the head of the Quantitative Self for Humans for Digital Health blog for this conference. And one of the things that he said that was really interesting was that medical data is not real. This is not something you have the right to be kept private. For example, your weight, your blood sugar, your anything, that is not your private information. It's a fact. And so it can't be kept private. So while the idea of medical data is very nice, I just want to get a little bit more specific on this, because I don't think that medical data is the right to privacy.
And I would like to add that a lot of patients want to contribute to research. So I think it's also, of course, it should be done in a very strict and right way, and the patient should be willing to share it. But to stop using the data produced, I don't think that's the right way to go.
And actually, absolutely agree on that. We use data for scientific studies, definitely. And we know that our product will look in 3 months absolutely different compared to what it is right now. And this is how it should be, because people evolve, like the whole markets evolve, the expectations evolve. But the concepts of our brain, of how it works, they stay more or less the same. So we use the data in an anonymized way to make sure to understand how people interact with what kind of challenges, what actually works, what doesn't. And this is what we do, like beginning from the University of Sydney, and in Germany with the Charité, with a couple of universities in actually Asia, to also understand how this differentiates, and it's almost everywhere the same. But what's really, really important, I believe, for every single digital health startup is to have this kind of authority proof. So, for example, after our award from the German Ministry of Health, we put it like on the checkout page, yeah. And sure, the monetization increased, incredible, because then people can differentiate you and your startup and see that you are doing something different compared to the competition. So this is why I believe it's incredibly important to make use of this data, and also to make sure that you are conducting a lot of studies and really pushing this whole industry forward.
But do you make money on the data?
Not in a direct way.
No.
Not
So
that
the data is not
you
a
don't
revenue
sell the actual
stream.
data.
But this data and the studies, they definitely increase enterprise value, or like the value of the whole industry.
Henrik, a question?
One basic problem for entrepreneurs that want to reach out in Europe is that we have all these different national healthcare systems. And it seems that you both are aiming as a main source of revenue to approach the insurance companies. So how would that model work in countries where you have national health services and not so much companies, insurance companies?
For us, we always actually approach with every country is the same playbook. First, we go on with influencer marketing. So for example, publisher, we create a buzz in the communication sector. Then we follow up with B2C direct response marketing, like performance marketing, and everything, native advertising, everything in this field. There is a lot of potential. And then we see, okay, what is the best idea to go to the market? In some markets, we directly work with hospitals, and the hospitals are paying us. They're providing it as a service. In some markets, we work directly with health insurances. They are reimbursing it. And in some markets, actually, people, like patients, pay it by themselves. So everything is possible afterwards. So I think it's very important to stay flexible. And a good friend of mine says, there is no one-size-fits-all in the health industry, especially because we have a lot of different regulations here. So I believe it's very important to stay flexible, think of what is possible in this business development field, the corporational field, and make sure that you somehow find the right key. So for example, direct reimbursement is always great. It's always, as you say, the holy grail. But there are way more, or a lot of more potential revenue streams than that. So I believe in direct payment, so really pay for what you get, pay for your results by yourself, is a way to go. And actually, our product costs like €7 per month. I mean, your product €4 per month. This is something what everybody can afford. We want to go to the masses to make sure that we really revolutionize what is like the digital health movement right now. Really push it forward. And this is only possible if you really have like critical mass behind you.
Just a short follow-up to that. Do you see an increasing willingness among consumers to pay for health services themselves, whether they have insurance or not?
Yes.
Yes.
You think that's
Simple answer.
Yes.
I have one last question. I know that we're running out of time. We could spend the rest of the afternoon here probably. One question that ties into what we've been talking about and what you talked about efficiency as well, and because there's one big thing we're talking about how to make money, but we know that the cost of unhealth and not doing anything about it is even actually bigger. But how do you actually work with that bulk of money that's already being spent, when people are unhealthy, and how do we make that work to our favor when we're trying to build things that make money? You understand what I'm trying to?
You answer? Shall I?
I don't know how to answer that question. I believe that society currently faces a few challenges when it comes to healthcare. One of them is more or less the locus of control. Who is in control of your health? Is it the government, the insurance, or you? Secondly, I believe that we have a great inefficiency in the system, where money is being spent in ways which, the system hasn't evolved much since the 80s when it comes to the administrative and bureaucratical processes in many countries. So by focusing on reducing the burden, the overhead on our physicians, maybe that's a way forward. So it's about changing the philosophy of the population and about changing the workflow of the professionals we have. The third one is one which is very scary, and that is simply there will be fewer and fewer doctors. So what's going to happen? Technology has the possibility to scale in a much broader way the knowledge and expertise of these professionals. So it's going to end up with a collaboration play into efficiency and prevention, I believe. So that's how I believe we can utilize the money already being spent in a better way.
Okay, and I think we have to end there because I know that our time slot is coming to an end. So I'd like to thank Fredrik and Jacob very much for this very, very informative time on stage. Thank you very much.
Thank you.